want to explore plastic surgery, but not sure where to start. And today we have plastic surgeon Dr. Jeremy White, who breaks down multiple facelift approaches and issues that you may be having and how to address them. Let's then move up to this under eye bag area. Like, at what point does it move from non-surgical to you need surgery, and what would the surgical approach be?
Yeah. So for the under eye bags, I look at a couple things. I look at what's the skin quality. So is this something where you have a lot of crepiness to the lower lids, to the skin itself? And then is there fat herniation, meaning do I see actual bags coming out? When I press on the eye, does it kind of pop out more? Those are really fat pockets that are now protruding out. And what does the infraorbital rim area look like? Does this look very hollow? Did the midface come down? So someone who's going to be a non-surgical candidate where I might use filler, which is something that kind of comes back to the people have moved away from filler dramatically. A lot of people used to inject it willy-nilly. And then we realized that over the years, and with some more recent studies also, this filler lasts a lot longer than we originally anticipated. It really does. And it can create long-term swelling to the area. So when I do that, I use it very cautiously. I'm injecting about half a cc per side and multiple different planes to get an effect. So past that, I'm really being very, very cautious about it. I haven't completely taken it out of my armamentarium. I still think it's a safe thing to do in the right patient, but it's always in the back of my mind. That's kind of pushed up on the PRF side of things, because a lot of patients will still come in. They'll say, listen, I don't want filler underneath my eyes. I've heard about the swelling issues. I want my own natural body stuff. Great. That's where we go. So someone who's going to do that, they basically have maybe some mild puffiness to the lower lids, a small amount of infraorbital rim hollowing in the area. Great candidates for doing either doing filler for an immediate result or doing some PRF treatments in a series to help build collagen and maybe some volume in the area. Once you're past that, then you're really talking about, hey, are you ready for lower lid surgery? And when I look at lower lid surgery, again, I'm looking at those three things. And with the skin, you can treat it with either laser. Some people will treat with laser, or you can do it with a skin pinch or remove a little bit of skin, and it tends to heal pretty nicely right underneath the eyelash margin. You can have a really well hidden scar that heals. The other part is the fat, and with the fat, there are lots of different ways to handle that too. You can handle that by repositioning, by taking the fat and trying to sort of either pinch it back into the globe. I've seen people will try to bring it down along the infraorbital rim to try and disguise it. In my experience, I think the most reproducible and straightforward technique is removing small amounts of fat from the area. And I typically do this from a flip the lid transconge approach. So I'll remove some fat from the area, and that will help to decrease the puffiness for a long time. And there are lots of patients out there, by the way, who have that as an isolated issue without a skin issue, typically younger patients. And those people, basically, you can do that surgery and they don't have any scars to show, just a little incision on the inside of the lid that you'll never see. So those are great. That's called a transcondylar lower blepharoplasty. And that last part is the infraorbital hollow. So as we age, again, we're talking about mid-phase volume loss, so loss of fat in the cheek, and this kind of comes down. And so you'll see, if you look at pictures of yourself from 20 years ago versus now, you'll see that actually the lower lid looks longer. So it's not because your lower lid just became longer. It's because you lost volume in your cheeks. And so now this is down here. So what I'll often do to take that result to the next level is I'll take fat and I'll place it along the infraorbital rim and the midface, and it looks amazing. It really just kind of helps to blend that transition from the cheek to the lower lid. So those are sort of the things that go in my mind. But I would say eyelid surgery is one of those things, usually not much of a downtime procedure, but really transformative.
Dr. White, what makes eyes older, aging, and what are the options?
Right. So one of the biggest things, again, gravity is our friend, but it's also our foe. So everything starts coming down. And when your brows start coming down, you start to develop a bit of hooding on the upper lid. So we're not creating new skin on the upper eyelids as we age. It's just that the brow is starting to come down. At a certain point, that brow can come down so much that it changes the shape of the eyebrow. So these are the things I'm looking at when I'm evaluating a patient on this region. And eyelid surgery is just so powerful because you can turn someone just like small procedures and really just make them look really well rested and just refreshed and open. So with upper lids, I'm looking at one, do they have excess skin kind of hanging out over the upper eyelid? If that's the case, then we're talking about an upper blepharoplasty. Sometimes we'll adjust some fat in the area too, but I find that as I go on in my career, I'm taking out less and less fat from the upper eyelids themselves, and that's the reason is I think unless you really have a big pooch somewhere or it's just really super heavy, you can actually make someone look. You ask what can make you look older. Hollow eyes make you look older. So that's another thing. You want to be very delicate about that. Preserve, I think, as much of that structure as you can. So upper eyelid skin, fine. We can take care of that with upper blepharoplasty. I can even do that under local in the office. So that's pretty nice, easy recovery. Tiny, tiny little stitches. So it's pretty awesome. But when that skin starts to come out towards the side here, now we're talking about you got two options. You can do a blepharoplasty and extend it out here. The scar is a little bit more visible, but tends to heal really well. Or you can add to that an upper or brow lift, basically, or brow repositioning procedure, which from a technical perspective probably has, I think, better longevity to treat the area if you add that in that particular situation. But there's a caveat to this because I'm going to ask the patients, well, what do you, if they tweeze, a lot of people will tweeze their brows or they'll pencil them in. And so that comes into play here too, because if they have something permanent in there and I start doing this, then they look really crazy too, right? So you have to understand what they've already done, what they've gone through, what's reversible in that situation, and then tailor the treatment to attain the best result.
Thank you, Dr. White, for spending time with us today. We've learned so much about surgical and non-surgical solutions for our various desires. We really appreciate you here on Beauty Seek.
Beauty Seekers, thank you so much for joining us today here on Beauty Seek. Our mission is to help educate beauty seekers as they embark on their journey for aesthetic procedures. If you like the content that you're seeing today and you'd like to hear education from practitioners like Dr. White, please subscribe. We'd love to see you.